Hi guys, today my topic is knee joint. There are 9 contents in knee joint: introduction, type, articular surfaces, ligaments, bursae, relations, blood supply, nerve supply, movements, and clinical anatomy. Coming to introduction, knee joint is the largest and most complex joint in human body. The complexity is due to articular surfaces. There are 3 articular surfaces in knee joint. Due to that, it is the most complex joint in human body and major weight bearing joint. And then coming to type, it is modified hinge variety of synovial joint. It is a hinge variety of synovial joint. Coming to articular surfaces, medial and lateral condyles of femur, patella, and medial and lateral condyles of tibia. It is the diagram of knee joint. These are the condyles of femur. These are the condyles of tibia. Among that, there is a patella bone. The articulation of these three bones, knee joint is formed. I repeat again, articular surfaces of knee joint is medial and lateral condyles of femur, medial and lateral condyles of tibia, and patella bone. Going to ligaments, there are primary and secondary ligaments in knee joint. The main function of ligaments are it provides stability. Ligaments provide stability and hold two ends of bones together. Ligaments hold two ends of bone together and it provides the stability. There are primary ligaments and secondary ligaments. Primary ligaments are fibrous capsule, ligamentum patellae, tibial and fibular collateral ligament, anterior and posterior cruciate ligament, medial and lateral menisci. And secondary ligaments are oblique popliteal ligament, arcuate ligament, transverse ligament, and coronary ligaments. After mentioning these 9 ligaments, we have to mention at least 2 points for each ligament. Coming to the fibrous capsule, it is the most common ligament, most common in all joints, and this fibrous capsule is deficient anteriorly. Fibrous capsule present medially, laterally, and posteriorly. Anteriorly, this fibrous capsule is replaced by quadriceps muscle and patella bone. This is about fibrous capsule. And coming to the ligamentum patella, it is the extracapsular ligament. Why? Because it is extracapsular. Fibrous capsule is absent anteriorly. Ligamentum patella is present anteriorly. So that ligamentum patella is extracapsular ligament. Ligamentum patellae starts from the apex of the patella to tibial tuberosity. The 2 points of ligamentum patellae, it is extracapsular and extends from the apex of the patella to tibial tuberosity. And coming to the tibial fibular collateral ligaments. Tibial collateral ligament, coming to the diagram, it is called tibial collateral ligament, superficial and deep collateral ligaments. The tibial collateral ligament also called as a medial collateral ligament because it is the medial side of the knee joint. Medial side. So, tibial collateral ligament also called as medial collateral ligament. Fibular collateral ligament also called as lateral collateral ligament because it is the lateral part of the knee joint. And coming to the anterior and posterior cruciate ligaments. These ligaments present in the joint, anterior and posterior cruciate ligaments. Anterior cruciate ligament is tight when we flex the knee, and posterior cruciate ligament is tight when we extend the knee. This is about 2 points of anterior and posterior cruciate ligaments. And coming to the medial and lateral meniscus. These medial and lateral menisci, this is the medial menisci, this is the lateral menisci. These medial and lateral menisci together divides the knee joint into 2 compartments, upper compartment and lower compartment. Upper compartment helps in flexion and extension, whereas lower compartment helps in medial rotation and lateral rotation. This is all about the primary ligaments of the knee joint. And these are the secondary ligaments of the knee joint. We have to mention at least 2 points about each primary ligament in examinations. This is all about the ligaments. I repeat again, ligaments provide stability. There are some primary ligaments and there are some secondary ligaments. Primary ligaments are fibrous capsule, ligamentum patellae, tibial and fibular collateral ligaments, anterior, posterior cruciate ligament, medial and lateral menisci. Coming to the secondary ligaments, oblique popliteal ligament, arcuate ligament, transverse ligament and coronary ligament. This is all about ligaments of the knee joint. Coming to the bursae. These bursae provide, there are 12 bursae around the knee joint. The main function of a bursae is to reduce friction when movement occurs. Bursae reduce friction in movement. Then among 12 bursae, there are 4 bursae anteriorly present, 3 bursae laterally, 3 bursae medially, 2 bursae posteriorly. Remembering these 12 bursae is quite difficult. So at least we have to remember first 4 ligaments which are present anteriorly. Subcutaneous prepatellar bursae, subcutaneous infrapatellar bursae, deep infrapatellar bursae and suprapatellar bursae. There are 4 anterior bursae: subcutaneous prepatellar, subcutaneous infrapatellar, deep infrapatellar and suprapatellar. Bursae we have in diagrammatic representation, we have to represent bursae with pink color. It is the suprapatellar bursae. It is the infrapatellar bursae. Diagram is very important, guys. By diagram only you gain more marks. And coming to the relations of knee joint, there are some anterior relations and posterior relations. Anteriorly, quadriceps tendon and patella. Posteriorly, popliteal vessels and tibial nerve. Again, anteriorly, anteromedial and anterolateral relations also present. Anteromedially, medial patellar retinaculum, anterolaterally lateral patellar retinaculum, posteriorly popliteal vessels and tibial nerve, and posterolaterally means tendon of biceps and lateral head of gastrocnemius, and posteromedially medial head of gastrocnemius. This is the all about relations of knee joint. And coming to the blood supply of knee joint, blood supply of knee joint is done by the anastomosis around the knee joint. It is the separate question, but in knee joint we have to at least mention by which branches knee joint gets the blood supply. Branches of popliteal artery, femoral artery, anterior tibial artery and posterior tibial artery. By these arteries knee joint gets blood supply. And coming to the nerve supply, femoral nerve, tibial and common peroneal nerve and obstetrical nerve. These are the nerves which provide the nerve supply to the knee joint. Coming to the movements, there are 6 movements: flexion, extension, medial rotation, lateral rotation, locking, unlocking. The main movements are flexion and extension. Flexion of knee joint is done by hamstrings. Extension of knee joint is done by quadriceps. And medial rotation and lateral rotation. Medial rotation and lateral rotation is done in flexor leg only. Coming to the locking and unlocking. Locking means medial rotation of femur over tibia. Means this leg. Medial rotation of femur over tibia is called locking. In locking process, all ligaments of the knee joint become tight, and the main muscle of locking is again quadriceps. And coming to the unlocking, lateral rotation of femur over tibia. Means like this, lateral rotation, because it is the lateral side of the knee joint, it is the medial side of knee joint. The main unlocking muscle of knee joint is popliteus. This is about locking and unlocking of knee joint. Coming to the clinical anatomy of knee joint. Knee joint has some clinical anatomies which are osteoarthritis, genu varum, genu valgum, genu recurvatum and injuries to ligaments. Osteoarthritis means it is an age related disease. Genu varum means bow legs, it is look like this. Genu varum look like this. And genu valgum, gum is knock knees. It look like it is knock knees. Genu valgum. Genu varum. Coming to genu recurvatum. Genu recurvatum means hyperextension. Hyperextension of knee joint is called genu recurvatum. Injuries to cruciate ligaments means ACL tear, PCL tear is come under to the injuries of crucial ligaments. This is all about knee joint. Now we come again back to our contents. I repeat again each content in detail. Introduction. Introduction, we have to mention largest and most complex. Coming to type, synovial type of hinge variety. Articular surface, condyles of tibia, condyles of femur and patella bone. Coming to the ligaments, some primary ligaments and some secondary ligaments. Primary ligaments are fibrous capsule, ligamentum patellae, anterior and posterior cruciate ligaments, tibial and fibular collateral ligaments. Secondary ligaments are transverse ligament, coronary ligaments, oblique popliteal ligament. These are the secondary ligaments. Coming to the bursae, there are 12 bursae around the knee joint. Among that, at least we have to mention 4 bursae. Subcutaneous prepatellar, subcutaneous infrapatellar bursae, like that. Coming to the relations, some anterior relations, some posterior relations. Again, anterior relations are divided into anteromedially, anterolaterally. Posterior relation divided into posteromedially, posterolaterally. Coming to blood supply, femoral artery, tibial artery. These are some arteries which provide blood supply to the knee joint. Coming to nerve supply, obturator nerve, femoral nerve, anterior and posterior tibial nerve. Coming to the movements, there are 4 movements: flexion, extension, medial rotation and lateral rotation. And coming to the clinical anatomy, genu valgum, genu varum, ONE, ligament tears. This is all about knee joint. If any doubt in knee joint, please comment below and the knee joint notes will provide in description. Thank you guys. Keep learning.